Do you think the new Alzheimer's drugs are worth it, are good for you? As a neurologist with 20 years of experience in taking care of patients with these conditions, I believe that these medications are not ready to be used for people. I wouldn't take it myself, and I would not recommend it for any of my family members. I have 5 reasons why I'm not in favor of giving these medications to patients. Number one, these medications reduce the levels of the protein in the brain called amyloid. Amyloid is part of the problem in shrinking the brain. See, your brain has different parts, and the part called the hippocampus, which is very important for memory and learning. Now, many vascular risk factors, many life choices can affect the size of the brain, and amyloid is part of the story, not the full story. These new drugs have been very successful, and I give credit to pharmaceutical companies to be persistent for the past 20 years, spending billions of dollars to find a drug that clears the brain of amyloid. Unfortunately, when they do that, patients don't come back and become normal. Why? Because a lot of shrinkage has already happened. These drugs don't make the new brain. So giving a drug that reduces amyloid is not going to make a person become normal again. Number two, these drugs are very expensive. They cost about $26,500 for the drug itself, but the drug requires a lot of MRIs, a lot of imaging, a lot of blood tests, close monitoring, and overall cost per year is $82,500 every year. And so would cost Medicare billions of dollars if all patients who have Alzheimer's disease or diagnosed with Alzheimer's disease take it. This is the most expensive drug ever, considering the cost of the drug and the cost of administering it. In fact, if everybody who has Alzheimer's take it, the cost would be more than the cost of all the other drugs for every condition combined. So I don't think it's a good idea to take this expensive medication, which may or may not be helpful anyway. Number three, these drugs have serious side effects. They cause bleeding in the brain, they cause shrinkage in the brain, the thing we don't want. And so I don't want to take that. And in fact, there's a high risk of mortality. Imagine somebody tells you that 16 of the 500 people who took this drug died. You wouldn't want to take that drug. Number four, these drugs are hard to administer. It's not like a pill you take in the morning. You have to go to an infusion center, you have to take infusion, you need to be monitored. And so it's very hard to administer, and it's actually expensive to actually administer it. Number five, the data that we have about these drugs show that they reduce the worsening of symptoms. They don't make patients better. They slow the rate of progression of symptoms for 18 months. We don't know what happens in 3 years. And this happened about 10 years ago when there was a drug Aricept, which showed that 18 months, they slowed the progression of the disease, apparently per symptoms. But at 3 years, there was no difference between people who took it and people who didn't take it. So for those reasons, I think it doesn't make sense to take these Alzheimer's drugs now. If it were cheap, easy to administer, and didn't have serious side effects like a supplement, I may consider taking it. But for now, I have a lot of other recommendations for you on what you could do to prevent the shrinkage of the brain in the first place. In your next video, I will tell you what to do exactly to have a sharper brain and have a much lower risk of developing Alzheimer's disease.